Hello, I'm Dr. Aris Thorne, and I am a clinical urologist with over 25 years of experience. Today, I want to have a very direct and private conversation that many men are too afraid or too ashamed to start themselves. It's about a moment of profound confusion. It's that moment of climax, the peak of intimacy, which is suddenly followed by nothing. You feel the sensation. The pleasure is there, but you look down, and there is no seminal fluid. It feels empty. This experience, known as dry ejaculation, is a silent alarm bell in the male body. For many men over 60, it's a source of secret panic. You might be worried it's the end of your vitality, a sign that your masculinity is fading, or, worst of all, a symptom of something terrible that you are not ready to face. I want you to take a deep breath. Your ability to feel pleasure and your very identity as a man are not at risk. But this is a critical message from your body, and it is not to be ignored. You must not ignore it. In this video, we are going to create the definitive guide to understanding exactly what is happening, why it's happening, and the action plan to take back control, starting today. 1. The hidden symphony. Why orgasm and ejaculation are not the same thing. Before we can diagnose a problem, we must first understand the design. Most men go their entire lives believing orgasm and ejaculation are one single event. This is the first myth we must break. They are two separate, magnificent processes that are simply designed to happen at the same time. Think of it this way. An orgasm is the neurological event. It's the fireworks show in your brain. It's a complex cascade of feel-good neurochemicals like dopamine and oxytocin, combined with rhythmic nerve signals that create that intense sensation of pleasure. It is controlled entirely by your brain and your nervous system. Ejaculation, on the other hand, is the mechanical event. This is the plumbing. It's the physical act of forcefully expelling seminal fluid. This fluid itself is a complex cocktail. It's not just sperm. In fact, sperm from the testicles makes up less than 5% of the volume. The vast majority of the fluid is a nourishing, protective liquid produced by your prostate gland and, even more so, your seminal vesicles. This mechanical process is controlled by a specific set of muscles, valves, and ducts. So when you experience a dry orgasm, it means the fireworks show is still happening. Your brain and nerves are working. But the plumbing system, the mechanical part, has a problem. The signal was sent, but the delivery failed. Our job today is to figure out why. 2. The main suspect. Retrograde ejaculation, the mechanical glitch. The single most common cause of dry ejaculation, especially in men over 60, is a condition called retrograde ejaculation. This is not a failure of production, it's a failure of direction. Let's use a simple analogy. Your bladder has a gateway, a small, powerful muscle called the bladder neck sphincter. During your entire life, when you reach climax, this muscle slams shut, tightly sealing off the path to the bladder. This forces the semen to take the only other available path, forward, out through the urethra. It's a perfect one-way street. In retrograde ejaculation, this gateway muscle fails to close. It remains relaxed or weak. So, when the powerful muscles of ejaculation contract, the fluid takes the path of least resistance. Instead of going forward, it is pushed backward into the bladder, where it harmlessly mixes with your urine and is flushed out the next time you urinate. You feel the full, intense pleasure of the orgasm, but nothing comes out. The mini masterclass on retrograde ejaculation, how to confirm it, the at-home clue. The simplest clue for this condition is to look at your urine immediately after climax. Is it noticeably cloudy or hazy? That is the semen, which has mixed with it. When you report this to your doctor, a simple post-orgasm urine analysis can confirm the presence of sperm in the urine, giving us a definitive diagnosis. Cause A. The surgical connection, the obvious culprit. The most common reason is a previous prostate surgery, specifically a procedure called a TURP. transurethral resection of the prostate, which is used to treat an enlarged prostate, BPH. During this procedure, the surgeon clears the channel, but this can sometimes damage the nerves or the muscle itself that control that little gateway. It's a known and very common side effect. Cause B, the medication connection, the hidden culprit. This is the one I need you to check right now. Many men are on medications called alpha blockers. These are brilliant drugs used to treat high blood pressure or to relax the prostate to make urination easier. You might know them by names like tamsulosin, Flomax, alfuzosin, or silodosin. The entire job of this medication is to relax the smooth muscles in your prostate and bladder neck. It's designed to make that gateway muscle relax. As a side effect, it can relax it so much that it no longer slams shut during climax. This is often the secret cause, and many doctors forget to mention this side effect. Cause C, the nerve connection, the systemic warning. Chronic, long-term diseases can damage the delicate nerves that control this muscle. The number one culprit here is long-standing, poorly controlled diabetes. Diabetic neuropathy doesn't just affect your feet. It can affect these critical autonomic nerves, leading to this mechanical failure. Other neurological conditions like multiple sclerosis or spinal cord injuries can also be the cause. I recall a patient, a 72-year-old gentleman named David. He came to my office, visibly distressed. He was convinced his life was over. The first thing I did was review his medication list. Sure enough, he had just been started on an alpha blocker for his prostate 2 months prior. No one had told him this was a possibility. When I explained that his body wasn't failing, that this was a predictable side effect of his new medication, the relief on his face was absolute. For him, the ease of urination was more important, and simply knowing the cause restored his peace of mind. For others, we can explore different medications. 3. The blocked path, obstructive anejaculation, the kinked hose. Now, let's say your gateway muscle is working perfectly. The fluid is directed forward, but it still doesn't come out. This brings us to our second major category, obstructive anejaculation. If retrograde ejaculation is a problem of direction, obstruction is a problem of flow. Think of your reproductive plumbing as a series of tiny, delicate tubes, or ducts. The semen must travel from the seminal vesicles and prostate through a tiny set of tubes called the ejaculatory ducts and into the urethra. This is a very narrow pathway. If this pathway gets blocked, it's like a kink in a garden hose. The pressure builds up, but the fluid cannot escape. This type of dry ejaculation often feels different. Men in my clinic describe it as a painful or congested orgasm, a sensation of pressure that is never relieved. The mini masterclass on obstruction. Cause A. Scar tissue, the old injury. The most frequent cause of blockage is scar tissue. This is often the result of a past infection. A severe, untreated sexually transmitted infection from your younger years, or a bad case of prostatitis, a severe inflammation of the prostate, can heal with scar tissue that seals these tiny ducts shut, sometimes decades later. Cause B. Cysts or stones, the physical blockage. Just like you can get stones in your kidney, you can get tiny calcifications or stones in the prostate or seminal vesicles. You can also develop small, harmless cysts. But harmless is relative. If a tiny cyst or stone happens to form right at the opening of one of these ducts, it acts like a plug, blocking the flow. Cause C. Surgical scarring. This is less common than with retrograde, but certain pelvic surgeries or even a prostate biopsy can sometimes create inflammation and scar tissue that leads to a blockage. Diagnosis here is more advanced. We can't just look at the urine. This is when we use a transrectal ultrasound, which gives us a high-definition picture of your prostate and seminal vesicles. We can literally see the blockage, see the dilated ducts behind it that are swollen with trapped fluid, and identify the cyst or stone causing the problem. The good news is that many of these obstructions can be treated with minimally invasive procedures to uncork the system and restore flow. 4. The power failure, hormonal deficiencies, the empty factory. So, we've covered a misdirection, and we've covered a blockage. What if the problem is that you're not making enough fluid in the first place? This brings us to our third and very serious category, hormonal factors. Remember, the prostate and seminal vesicles produce the volume of your semen. And what hormone is the engine for this production? Testosterone. As men age, testosterone levels naturally decline. But for some men, this decline is severe, a medical condition called hypogonadism. When your testosterone levels fall off a cliff, the entire system slows down. It's like a factory running with no power. The seminal vesicles and prostate shrink. They stop producing enough fluid. This rarely happens in isolation. A man with dry ejaculation due to low testosterone will almost always have a cluster of other symptoms. Does this sound like you? A dramatic drop in libido or sex drive, trouble achieving or maintaining erections, erectile dysfunction, a pervasive bone-deep fatigue that sleep doesn't fix, loss of muscle mass and an increase in body fat, especially around the belly, brain fog, difficulty concentrating, or even feelings of depression. The absence of ejaculation here is not a mechanical glitch. It's a systemic shutdown. This is a 5-alarm fire for your health, not just your sex life. This is diagnosed with a simple set of blood tests in the morning to check your hormone levels. If a deficiency is confirmed, testosterone replacement therapy, TRT, can be life-changing, restoring not just sexual function and semen volume, but also your energy, your mood, and your overall vitality. 5. The red flags. When dry ejaculation is a warning for cancer. We have discussed the common and mostly benign causes, but as your doctor, it is my absolute responsibility to discuss the rare but critical cases where dry ejaculation is the first red flag for something more serious. Do not panic, but do listen very carefully. If your dry ejaculation appears suddenly, without any new medication or prior surgery, and it is accompanied by other symptoms, you must see a urologist immediately. Red flag. 1. Blood in the urine, hematuria. If you see blood in your urine, with or without a dry orgasm, this requires an immediate workup. It can be a sign of bladder cancer, which can sometimes grow near the bladder neck and interfere with its function. Red flag 2. Blood in the semen, hemospermia. If, before the ejaculation became dry, you noticed that your semen was brown, pink, or red, this can be a sign of inflammation, prostatitis, but it can also be an early warning for prostate cancer. As a tumor grows, it can block the ejaculatory ducts or cause bleeding. Red flag 3. Deep, new pelvic or bone pain. If the dry ejaculation is accompanied by a new, persistent ache in your pelvis, your lower back, or your hips, this is a major warning sign. Advanced prostate cancer can spread to the bones, and this is often the first symptom. I am not telling you this to scare you. I am telling you this because early detection is everything. If a patient comes to me with sudden dry ejaculation and pelvic pain, I am not thinking about alpha blockers. I am ordering an immediate PSA blood test, an MRI, and further imaging. In the vast majority of cases, the cause is benign. But we never ignore the possibility of the serious causes. 6. The emotional fallout. The unspoken impact on your masculinity. Now, I want to talk about the one thing most doctors ignore, the part that happens in your head and in your heart. For a man, the physical act of ejaculation is often deeply, psychologically tied to his sense of self, his performance, and his virility. When that physical confirmation disappears, it can trigger a profound emotional crisis. I see this in my office every week. Men who feel broken, men who feel incomplete, men who feel like they are no longer real men. This leads to feelings of inadequacy, anxiety, and deep frustration. And what happens next? You start to avoid intimacy. You pull away from your partner, not because you don't desire them, but because you are afraid of that moment of failure, of the confusion, or of having to explain something you don't understand yourself. This is the most tragic part of this condition, because it is based on a misconception. Your vitality is not measured in milliliters of fluid. Your ability to be a loving, intimate partner, your ability to feel and give pleasure, is not dependent on this one mechanical function. Your brain, your nerves, and your heart are all still working perfectly. Breaking this cycle of shame starts with information. It starts with you understanding, this is a mechanical glitch from my prostate surgery, or this is a side effect of my blood pressure pill. Understanding the why lifts the emotional weight. It allows you to have an open conversation with your partner, to explain, my body has changed, but my desire for you has not. Intimacy is a broad, beautiful landscape, and ejaculation is only one small part of it. 7. Your 4-step action plan: how to take back control. You have listened, you have learned, and now you are empowered with information. But information is useless without action. If this is happening to you, here is your practical step-by-step plan. Become a detective, not a patient. Write down the story of your condition. When did it start? Was it sudden or gradual? Did it start after a new surgery? Did it start after a new medication? Check your medicine cabinet right now. Is there pain? Is there blood? This information is the most valuable gift you can give your doctor. Break the silence at home. If you are in a relationship, you must have this conversation. Find a quiet moment. Use what you've learned today. You can say, I've been worried about a change in my body and I've been pulling away. I learned it's a medical condition and it has a name. It's called retrograde ejaculation. It doesn't change how I feel about you, but I needed to understand it before I could talk about it. This one act of vulnerability can transform your relationship. Schedule the appointment, the non-negotiable step. You cannot and must not self-diagnose this. There are too many possibilities, ranging from harmless to life-threatening. You must book an appointment with a urologist. This is not for your ego, it is for your health. Embrace the solution. Be open to the solution, even if it's not what you expect. The fix might be as simple as changing a medication. It might be a minor procedure to clear a blockage, or the fix might simply be a diagnosis, a confirmation that it's a harmless, permanent side effect of a life-saving surgery. In which case, the solution is acceptance. The solution is to separate your identity from this one function and to re-engage in a full, satisfying, intimate life, free from the burden of shame. Your best years are not behind you. Your health is a story you are still writing. Don't let shame or fear stop you from turning the page. If you found value in this message, if you feel even a little less alone, please help me get this information to others. First, share this video with a friend, a father, or a brother. This is information men need but will never ask for. Second, leave a like on this video. That's not for me, it's for the algorithm. It tells the system that this message is important and helps it find other men who are right now searching for these answers in secret. And finally, subscribe to the channel and turn on the notifications. We are just getting started in our mission to build a definitive, judgment-free library for your health. I'm Dr. Aris Thorne. Stay informed, stay proactive, and be well.